We know that this is serious. We also know this is especially serious for our neighbors who are elderly. And this is why we must all take this seriously, even if you're not in the vulnerable population.
Governor Bill Lee talking about why it's so important to take the coronavirus seriously. There are now 18 confirmed cases of COVID-19 in Tennessee.
Yeah, today the governor signed an executive order declaring a state of emergency, which does a number of things to help people during this time.
This day has seen a number of developments. March Madness is now canceled, along with the SEC basketball tournament in Nashville. Vanderbilt University Medical Center is constructing a large triage complex in one of their parking garages, designed to be a temporary screening area for patients.
At least 6 school districts are closed. We have a full list for you right now on newschannel5.com. In Kentucky, where there are now 10 confirmed cases, Governor Andy Beshear is recommending schools stop in-person classes for at least 2 weeks. And here in Nashville, the city has seen 135 cancellations for events. That is a direct spending loss of more than $35 million. With that state of emergency, the governor and top state health officials released some key information about how they plan to slow the spread of coronavirus. And they need the help of all Tennesseans.
News Channel 5's Kyle Horan has the very latest from Governor Bill Lee and just what that means for the state. Kyle.
So the virus is here in the state. It's not a reason to panic, but the governor says it is something that should be taken seriously. What the state is trying to do is something called flattening the curve, which is shown right here. Let me explain what that means. Take a look at this graph. What you're looking at is a chart from the CDC about why slowing the spread, even if it doesn't stop altogether, is important. You can see that if left unchecked, viruses have the potential to overwhelm the healthcare system. We're talking when hospitals and doctors' offices can't handle the capacity at the outbreak. But over time, if precautions are taken, the state could achieve this result. The pandemic lasts over a longer period of time, allowing the healthcare system to handle it. That's where people come in. The general population is relatively safe from the virus, but the elderly and people with underlying conditions such as heart disease and diabetes are at risk. People need to wash their hands and also try not to come into close contact with others. Those in the vulnerable population are asked to stay at home if they can and avoid mass gatherings. The governor says that's why so many events have been canceled right now with these concerns in mind.
I would encourage every person to the degree that it is non-essential for them to have as much distance from crowds of people as they can. But people have to make those decisions individually, and the implications for those decisions are broad. So that'll be up to individual institutions and organizations and individuals themselves.
And of course, the advice that we've been giving you the whole time stands: wash your hands and don't get too close to other people. Back to you.
Kyle, thank you.